Okay, so this is our presentation over emotional behavioral disorder. Here we have our guided note sheet. Dr. Lim will send a link. And so to start off, I'll give you guys a description, a definition of what EBD is. So it's basically a condition exhibiting one or more of the following characteristics over a long period of time and to a marked extent that adversely affects educational performance, which includes inability to learn not due to intellectual, sensory, or health factors, inappropriate types of behavior or feelings, or even the tendency to develop physical symptoms or fears. The term includes children who are schizophrenic, but it does not include children who are socially maladjusted, which means a persistent pattern of violating social norms with substance abuse, or a person struggling with authority. The second part is that the general agreement within the definition is that the behavior is extreme, the problem is chronic, and that the behavior is unacceptable because of social or cultural expectations. So now we're going to talk about causes. And there are three different types of causes. The first one that we'll be talking about is biological causes. This could include genetic disorders, brain dysfunction disorders, or childhood temperament considerations, or even severe malnutrition. An example of biological causes could be traumatic brain injury, or even newborns' inborn tendency towards certain behavioral patterns. Another cause is family factors, which is family definition and structure, which means single-parent families and or substitute care, and also family interaction patterns like child abuse. The third cause is cultural influences. This could be because of peers, changing schools, or the influence of the neighborhood. For peers, it could be the absence of peers who serve as positive models for children, socialization patterns with peers. For schools, it could be experience with instability than others, that they could experience more instability than others. In other words, a child who moves schools a lot. And in the neighborhood, it could be growing up in poverty, gangs, drugs, could also be an influence to the cause. The prevalence for this is that overall 3 to 6% are affected by this, and this is just the student population. Majority are males with EBD, and that the males outnumber girls about 5 to 1 in externalizing behavior. I will talk about later on. For in the city, it affects mostly European American with 58.3%. Second is African American with 28.4%, and then Hispanic at 10.6%. For characteristics for EBD include academic achievement. It includes academic difficulties like in reading, writing, and math. They don't have motivation, strategic learning, receptive and expressive delays. Another part of the characteristics includes social and emotional behaviors. This could mean talking out, fighting, profanity, isolation, or the interactions they have with their peers. As I said before, I talked about externalizing behaviors. There are classifications for EBD. The first one is externalizing behaviors, which is instances of defiance and disruption, most notably aggression and non-compliance. And aggression can be verbal or non-verbal. Some examples of this include yelling, teasing, tantrums, using profanity, stealing, property destruction, or even threats of violence or the use of violence towards peers and or teachers. The second classification is internalizing behaviors, which include social withdrawal, anxiety, and depression. Social withdrawal, which is when they spend an excessive amount in solitary play, meaning they're playing by themselves, and they have a lower rate of verbalization and positive social interactions with peers and adults. Anxiety is when they have difficulty concentrating, excessive worrying, or they seek reassurance. And depression is when they have pervasive symptoms that affect their mood and thoughts. And so for my activity, I made a Quizlet, which you can click the link and it will have the definitions of it. It'll have true or false questions.